Okay, well, it is 2:01. I wanted to welcome everyone to today's webinar presentation, How to Write an Acceptable Plan of Correction. Again, I'm Marcy Gallagher with Mountain Pacific Quality Health, and I am the long-term care account manager for Montana. Just a couple quick housekeeping items before we get started. This meeting is being recorded. The presentation slides and handouts have been sent out prior to the meeting, but if you were just registering in the last 10 minutes, those might be a little late in getting to you, but we will get those to you. And the recording will be available on our website in about a week or so, so we'll send you that link when that's available. Since the call is being recorded, all lines have been placed on mute to eliminate any background noise. But at any time during the presentation, feel free to unmute yourself to ask questions. If you are using the Zoom and you're logged in through your computer, you can click on the microphone icon to next to your name.
Oh, she messed up. Let me forward this to you.
Okay, thank you.
Yeah.
Mary, could we mute that person? Okay, I think we got it. So again, if you're logged in, you can click on the microphone icon to ask a question, or if you can also ask questions using the chat feature at the bottom of the screen. If you are logged in only using your phone, you can use the number 6. You could *6 to mute and unmute your line. So again, that's *6 to mute and unmute. And now I would like to introduce our speaker, Mary Jo MJ Marks. MJ has been in the healthcare field for 34 years, 28 years of that as a registered nurse. She's board certified through the American Nurses Credentialing Center as a gerontological, I knew I was going to group this up, gerontological nurse, and is a certified professional in healthcare quality. She received her bachelor and master's degree in nursing at the University of Mary in Bismarck, North Dakota, just 20 years apart. She has worked for Glendive Medical Center for 13 years in many roles, charge nurse, resident care coordinator, home health hospice manager, director of nursing, and is currently the director of quality for her organization. Her professional passion is aging services and the quality process, and when not carrying out her professional passions, you would find her with her family quilting, cross-stitching, and baking. I also wanted to just note that we realize that there are participants from other states besides Montana on this call, so there may be differences in the plan of correction process, so just keep that in mind. So at this time, I will go ahead and turn it over to MJ.
Hey, thank you so much, Marcy, for that introduction. I appreciate it. I'm really excited. I am also very humbled by the amount of people that are on this call. I hope I can do this justice. I'm going to do my best. I do want to say that even though I put this presentation together and did all of the hard work, I didn't learn to write a plan of correction on my own. I had some great mentors, and their leadership and mentorship is a huge part of this process. So without further ado, as you can see on your screen, you're panicking, I have to write a what? And so we are going to just talk about some acronyms that are probably pretty prevalent in a plan of correction. So some of you may have gotten that CMS 2567. You're like, oh yeah, I know this stuff, but there might be people on this call that are like, I have no idea what this form is and how to interpret it. So we're going to talk a little bit about that. So DPHHS, Department of Health and Human Services, 2567. I don't know in other states, but at least in my organization, we call it the 2567. And that is the form used to list the deficient practices identified by the surveyors here in Montana. CMS, our Centers for Medicare and Medicaid, VA, Veterans Administration, because I have a unique situation here in Glendive, and I'll share that with you as we go along. Working days are the days that DPHHS or your Department of Health is in the office. And actually in Montana, that is only 4 days a week. They work Monday through Thursday for the most part. Calendar days, obviously 7 days a week. And POC, plan of correction, not, and a lot of people who are new to this role will go, plan of care? What? Well, it sort of is. It's a plan of care and how to make things better after the survey agency has been there. So we have some timing things that we have to learn about. So when you have your survey and they are exiting, there's going to be a spiel, and this is pretty exactly how they say it. Your Department of Health has 10 working days to get the 2567 back to the facility after the date of exit. Now, there is an exception. I don't know about other organizations or other states, but we have state-owned facilities here in Montana that have management agreements with others. So we here in Glendive have the Eastern Montana Veterans Home. And so that's a little unique because the regional CMS office has to sign off on it. And so that really changes things. So as you can see, for state-owned facilities, they have 10 working days to get that 2567 to the regional CMS office in Denver. Trust me, at that point, I can't tell you how long it takes to get back to us. So in normal situations, the facility, after they get it, they have 10 calendar days to return that plan of correction to the Department of Health or the regional CMS office upon that receipt. The facility has 45 calendar days from the date of exit to be in compliance. Exception for state-owned facilities, at least in Montana that I'm familiar with, is that regional CMS office in Denver determines the compliance date for us and will tell us when we need to be in compliance. So we're actually going to do some little things. Don't have to shout out, but I would love Marcy and Mary to keep track of the chat, as well as to look at, we're going to practice some timing. So if our exit is on March 15th and DPHHS has 10 working days, about when should we expect that 2567 to come back to us? About what date? And everybody, work together. If you've got some more people in your office, and just put in the chat when you think that's going to be, or bust in and tell me too. I'm good with that. By March 25th. Yeah.
You can see the chat, MJ. Okay.
Yep, I got it open. So interestingly enough, remember your Department of Health has 10 working, or not working days. Yes, 10 working days, which means they don't work on weekends. So it's actually going to be a little bit longer, but yeah, somewhere 27, 28, 29. You're right. Kind of depends on where that weekend falls and exactly, if they only work 4 days in the office, it might be a little longer. If they work 5 days, it might be a little shorter, but it's not going to be right 10 days from the calendar because they have business working days. Now, let's say we got it on the 29th. That was the 10 working days. When do we need to return the plan of correction? And remember, it's calendar days for the facility. So if it's March 29th is when we received it, we have 10 calendar days to return it. Go ahead and chat that, or, oops, sorry. I bumped my mouse. Yeah, April 8th. Oh, so there's a state that tells you the due date of submission. Yeah, ours kind of does too, but it's also really good to be able to figure it out on your own. So Rebecca asked a question, do the 10 days include the day of receipt? Not in Montana that I'm aware of. We always count the day after as day one. So when is the date of expected compliance? When we're exiting on March 15th, you've got 45 days. Yep, you're correct. 4/29 would be the date of compliance. That's correct. You guys are doing a great job with that. So I won't make you go through the second one, but just it's the same thing if you want to. Okay. Okay, so so Jessica put something in the chat, and that's great. We start writing our plan of correction definitely after the state leaves, but invariably what we have found is there are some things that we have to wait till we get that 2567 back to see exactly how they word it, because if you're too broad, you may get your plan of correction back because it doesn't answer exactly what they're writing, at least in the state of Montana. But we do start writing our plan of correction literally right after they leave. We have a good idea of what our plan is. We have a good idea of what our audits are. But we always, you know, we've kind of got things in a rough draft form. Okay, so next slide. There we go. So when we're reading that 2567, we have abbreviations. We have the assessment reference date, our minimum data set, treatment administration record, and numerous other things. There is a whole section right on the first page of that 2567 that is going to say, these are the abbreviations that we used. And then it is going to go into the deficient practices. This is the tag language. This is specifically out of the state operations manual. They then tell how the facility, how they believe the facility is not in compliance, and they give their list of evidence. So tag language, ADLs do not decline unless unavoidable, and then it is literally copied and pasted right out of there. Not met as evidenced by, and like I'm just taking it right out of there based on observation, their record review, their interview. We failed to prevent resident declines in ADL status related to eating during meals. And this is where I was talking about wanting to be very specific, because if you just wrote it off of resident declines in ADL status, that is a lot to look at. But they're specifically citing it related to eating during meals for 2 out of 10 sampled residents. There we go. And then their findings include, and all of their evidence supporting why they're citing that deficient practice. So that was just kind of a format. For those of you who, I'm going to tell you to get your handouts out, because we're actually going to look at some actual deficiencies and kind of walk through writing a plan of correction a little bit. So, so 5 steps we must accomplish. And so in your handouts, there should be one. And again, this is based off of a template that we use here at Glendive Medical Center, and how we fill it out to be typed back into our electronic plan of correction. But step number 1 is to address how corrective action will be accomplished for those residents, patients, items, locations found to have been affected by the deficient practice. And then the second one is how the facility will identify other residents, patients, et cetera, having the potential to be affected by the same deficient practice. So when you look at this, okay, and I'm going to just put this in here. This is really, whoops, go back. So we're going to talk about those first 2 steps. And so as it says in number 1, in the right-hand side of that document, we want to make sure that what did we immediately do to fix the problem identified, whether it's for a resident, a location, an item. So I have examples on here. You know, there was a mat found with mold that was disposed of immediately upon notification by the surveyor on the date you removed it. Or an exit sign on a specific exit was fixed on that date. Any consults, work orders, any narrative that was done that you fixed immediately to address that corrective action for what was found. And make sure that you keep, like if you put in a work order to your maintenance, or that's an email, you keep a copy of that, because you will have to share that in your response when you have to prove that you followed through on your plan of correction. And then we always have a completion date that we put on that step. And usually this might be, it cannot be before the date of exit, or even the date of exit. So it might be they left on the 15th, it's dated the 16th, because we actually fixed it in the middle of the survey. And so that completion date for the number 1 is usually very close to that exit date. So in the chat, let's talk about what kind of things have you guys had, and just give us some thoughts. Or jump in verbally as well.
Hi, this is John from facilities.
Yeah.
So when we're writing our plan of correction, one of our biggest problems is that getting what we need in time, because we live in the middle of an ocean.
Yes, yeah, that is very true. And you know, sometimes we are a very small facility. Sometimes it's hard to get stuff here as well.
And
Yeah.
most of our contractors are from Oahu, which is 100 miles away. So when we need things repaired, we have to schedule. So meeting the dates, the times and stuff, it's pretty difficult.
Right. When that happens, and I have a question, I don't know, with the state of Hawaii, when that happens for you, are you able to say, you know, yes, we're working our plan of correction, but I can't get a contractor here till 3 days after my compliance date? Is there leniency for that?
So far, they've been lenient, but it's not 3 days, it's sometimes 3 months.
Yeah, yeah. I can imagine when the contractor has several and the only place to get from one to the other is on an airplane, or if they have to ship a part, or yeah, that's got to be so.
So we just have to be truthful and say what it's gonna take us, even if you give us 30 days, right?
Yep, yep. And be truthful. And like you said, you know, every state has their challenges. We get blizzards in the state of Montana, and sometimes that can hold up, you know, items to fix things. And it is that, you know, we had a blizzard and we thought it'd be here and it's not here. And yes, someone just said you ask for a 45-day extension. Is something that we do here in Montana. And I think when you're able to say, you know, we have done everything we possibly can do, and now we're at the mercy of someone else, you've done your part. Yeah.
That's
Okay.
the toughest part in writing the plan of correction, is always the date that it's gonna be accomplished.
Right.
Because
Yeah.
most of our citations was fire doors, and fire doors itself for here, it takes 4 months to even get it here.
Yeah. Yeah.
That's, you know, that's why we gotta keep asking for extensions and give the reason why. But that's probably the most hardest part for us to fill up the plan of corrections.
Sure. Okay. And so the other thing I have on here is, you know, delegate items. And so as we're talking about steps 1 and 2, the second step is figuring out how other residents, patients, etc., could be affected. And that might mean doing an audit of every single resident. Delegate, figure out what you need out of your audit, delegate it to, you know, break it up. We have a veterans home. Right now, we have about 60 residents. We have capacity for 80. And, but you're trying to do 60 residents within, you know, 4 days. You delegate. You say, hey, can you do this wing? Can you do this half of this hallway? And you get everybody, you teach them what they need to look for, and you have everybody help. I respond to writing a plan of correction is all hands on deck. Even though we've started, now we see the actual language, and we want to make sure that we are responding to exactly what the concern is from, or the deficiency is from our survey agency. And so it is all hands on deck. Every manager that's been impacted by that. And if there is a group, you know, guess what? You got through survey and dietary did not have any deficiencies. Is there something that dietary manager can help with, even though their department wasn't impacted? Okay. All right. Okay, so steps 3 through 5. Okay, so the third one of the larger, like I said, the template that we use is address what measures will be put into place or what systemic changes you will make to ensure the deficient practice does not recur. That's number 3. Number 4, how does the facility plan to monitor its performance and make sure solutions are sustained? And obviously your plan of correction must be integrated into your quality assurance system, your QAPI plan. And then lastly is when are you going to be done with your corrective action? This date should include any training and any other final steps that are required. Make sure that we don't have, the date cannot be the same as the date on a statement of deficiencies, which is that exit date. It has to be after. And unfortunately, this one says longer than 60 days. It's actually 45 days from exit. And I apologize that I did not catch that typo. So again, in your real world. So we're going to talk about number 3. The first thing is what policy and procedure needs to be reviewed. Even if you don't change it, what do you need to review? Because you have to show that you've reviewed it. What education do you need to do? And who's going to do it? How is it going to be accomplished? Who's responsible? And then, and those 2 are in number 3. Number 4 is that's when QAA meetings, that's when you're putting down how often your audits are done. Our routine, I have a usual routine, monthly times 3, quarterly times 3 to equal a full years of auditing. Then you have to make sure that you're talking about those, you're having a quality assurance and assessment team meeting prior to the date of completion. So if the date of completion is April 29th, you need to have had a quality assurance and assessment team meeting prior to that date, reviewing all of the audits, any policy changes, and how the education went, and what else do we need to do to ensure that we are ready and can turn everything in to be in compliance. We have something, and again, I am not going to take credit for this, but on this handout, we have something that we actually put in bold and we never change it. It says note. If the results are not found to be satisfactory or sustained, the audits will be continued every month. If the results are still not satisfactory, the QAA Council may authorize a performance improvement project charter to deeply analyze the lack of improvement. Now, please know there are times that we're doing weekly auditing. There are times we're doing daily auditing. We have had so personal experience and working with plans of correction, meal documentation not being really good in the medical record. And not necessarily that there's a weight loss issue, but the fact that you're not getting your meals documented. You're going to have to audit that daily. At least we did for quite a while to help keep it in front of people and make sure that it was getting done. And then if you're not seeing improvement, to really put together a project of those people who are working frontline staff members, because, you know, I was a frontline staff member, but it's been a few years and processes change. And there are new people who can bring a lot of great, fresh ideas. So really important to make sure. And I think if there's surveyors on here, you can tell me if I'm wrong or not. But I do think that surveyors want to see that you're going to use that QAPI process to improve. And so they want to see that you're going to do projects if things aren't getting better. Okay. And the last one, number 5, that's just a reiteration of all of those dates. So step number 1, like I said, might be the day after they exit because you actually fixed it during the survey process. And then how we do it here at Glendive, this can be up to any person, administrator, DON, whoever is managing their specific plan of correction. And obviously your administrator needs to sign off on that, but we have a completion date for each step. And so let's say the completion date is March 16th. So 1 week later, we want to have step number 2 completed. And 1 week after that, we want to have step number 3 completed. And in step number 3, that may not necessarily be when the education is happening, but that the policy and procedure has been reviewed. You know what you're going to be doing. If you have to develop a new log, a new worksheet, a new form, that is all done at that time. And then basically number 4, our completion date is about 3 weeks after that exit. We might push it out a little further because we still have 45 days. But that gives us kind of a guideline to stay within to the best of our abilities. Okay. All right. So in Montana, our plan of correction is transmitted to DPHHS via a secure link. I don't know if that's the case in every state that's on the call, but that is how it is done here in Montana. For specifically long-term care, for the hospital, I hate to even admit this, but I'm really not sure. I have not been through a hospital survey here at Glendive yet. So, but I know in the long-term care, it's a secure link. And then you work your plan. You start working your plan. At the end of the 45 days, or not end of 45 days, I'm sorry. You send in your plan of correction. You may get a request. They may send it back and say, no, this isn't acceptable, or I don't agree with this, and you have to give more information. You update your plan of correction, but you're continuing to work it. Because you have to get steps 1 through 4 completed before the compliance date. I think, well, as I said, I've had some great mentors that, I've been here at Glendive since 2008. And in that time of 13 years, 12 years, something like that, I would say we've had 1 request for more information. And I'm coming from a situation where the Eastern Montana Veterans Home is surveyed twice a year, once by VA and once by DPHHS. And then we also have an extended care that's attached to our critical access hospital. And that is also surveyed once a year. So yeah, we very seldom have to. Doesn't mean we're perfect. It just means we've learned how to give them what they're looking for, and how to do our best to be in compliance. So revisit surveys. Revisit surveys are can be done over the fax, where they say, hey, it's, or via email sometimes now as well. And it says, hey, this is your revisit survey. We need to have all of your evidence of your completed plan of correction. So everything you've done in steps 1 through 4 on that plan of correction, those items, you have to make sure that as you're working that plan of correction, that you are keeping work orders, you're keeping written documentation of something that was done. You are keeping audits. Now, when I say that, I'm not saying the raw data. I'm saying the percentages. So for example, you're doing raw data on a hand hygiene and you've got 10 data sheets for a week. So for the week of March 23rd, you audited 25 people. That's your denominator. Your numerator is how many did the World Health Organization's 5 moments of hand hygiene appropriately. Was it 10? Was it 3? Whatever that was, and it's the percentage. You want to keep that raw data for yourself, but you need to, you don't have to be sending them their raw data. It's a percentage of that. The other type of revisit survey obviously is on site. They're coming on site. They're going to be specifically looking at a high level deficiency that they want to make sure that you're in compliance. And so, and again, you have to have that folder with all of your evidence that you did everything that they wanted. They're going to review that. And then they're going to go back out to the floor and say, hey, you know, or wherever it was that they felt they had that there was a high level deficient area, and take a look at that. In COVID world, oh my goodness, in COVID world, all of this looks so different in some situations. They'll still come back on site, particularly if there's an immediate jeopardy. But for the most part, they're doing fax revisits. You know, they want to make sure our elders are certainly well taken care of, and that's their job. So we're glad to have them partner with us. So what, as I've been talking ahead of myself, copies of all your audits, copy of any of those care plans, anything you had to update, copies of all your policies you reviewed, any new forms, copies of all education, and the sign-in sheets where you had the staff sign in that they were there. And if staff could not attend when you wanted them to, that you then worked out a process to get them educated before they were working again. Okay. So, and now I believe we are at questions, and I'm pretty excited. I've left 20 minutes, and I tried to give you a good overview, and hopefully it will be helpful, but shoot your questions at me, because, you know, it's hard for me to know that I have answered what you need. So now is the time in the chat, or go ahead, talk to me. What can I do to help?
MJ, do you see the question in chat from Julia?
Let me look.
Most common reason for a plan of correction not being accepted.
Oh, most common reason for a plan of correction not being accepted is that you haven't reviewed a policy or procedure, or you haven't really answered what they're citing. And that's why I said we start a rough draft. We kind of know what they're going to say, but we don't finalize that till we actually have that 2567 in front of us. And if they really, what they're really citing. So for example, I read you language about the decline in ADL status earlier in my slides, but what they were really citing was only about meal times. And so if you wrote about the whole ADL status, you would probably get it back because you missed the intent of what they were really citing. And in the chat, I see from Jill, can you please address the process if you want to IDR the survey, or did I miss you speaking to this? No, you did not miss me speaking to the IDR process. And I have to tell you, the IDR process just makes me want to crawl. Yeah. Gosh, I have to be very honest. I have not participated in an IDR process. And I'll give you a couple of reasons for that. The leadership that I have worked with within my numerous long-term care facilities always felt that when they got their 2567 and they read it, that there was some nugget of truth to the deficiency. And there have been times where we didn't necessarily like that deficiency, we didn't agree with it, but going through the IDR process would truly just be not worth it to us. Do we hold off on submitting the plan of correction if we're planning to do an IDR? Absolutely not. You cannot hold off on submitting your plan of correction, even if you're planning to do an IDR. And I know that at least in Montana, that is part of the spiel on the exit survey, exit interview of the survey, is they tell you you have to still submit that plan of correction. You still have to be working that plan of correction, because the IDR process can take you up to 3 months to actually move through. IDR is not simple and easy. So, you know, oh, you're very welcome. It is worth reiterating. Thank you. It's definitely worth reiterating. And you know, if we truly felt when a surveyor walked out the door that we had information that they had not taken into consideration something, we would still send that to them. When we, in our surveys here in Montana, we have been told, so I'm in Eastern Montana and I am a good 8 to 10 hours from Helena, which is normally where our survey team comes out of. So they will drive. And if there's anybody from the Montana DPHHS, plug your ears, they will drive from Helena on Monday. They will show up in my facility anytime between 4 p.m. and 6 p.m. And if they get here late enough in the day, they'll show up about 7 a.m. on Tuesday morning. But when they leave on Thursday, because they work 4 10s a week, we usually are told if there is anything missing that you think we need to take into consideration, please have it emailed or faxed to our office by noon on Friday. And because there's a timestamp on it, they will review that information when it goes through the process. So that's been our experience here in Eastern Montana, where we are, like I said, 8 to 10 hours from the survey agency, just because of it comes out of Helena. So other questions? Kelly, thank you. You are correct. I appreciate it. Yep, find the nuggets of truth on that deficiency. Okay, and David, yep. Okay. Anybody else? I'm trying to keep up on the chat, but just in case I've missed one, please Marcy and Mary be looking as well. And I'm always okay if you want to jump in here and just talk. That works for me too.
I just wanted to jump in and mention the handouts. So again, those were sent out before the meeting, but if you registered just prior to the meeting, you may not have got. So we were trying to catch everybody in chat as they submitted their email. And I believe Mary Argonis resent them to everybody. So hopefully we have it covered, and those will also be on our website as well. But let's see, anybody wanted to unmute themselves? So are there any other comments on the IDR process? Anybody else who has gone through it who might want to offer their 2 cents or feedback?
Yes, please. Like I said, I don't have a lot of experience with it, so I would certainly take anyone else willing to share.
Right, MJ, were you saying to share on the IDR process?
Yes.
Yeah, this is Dana Mitchell. I'm with Mountain Pacific in Alaska, and prior to that, I was quality director for a couple of nursing homes here in Anchorage. And my tip is just like I posted in the chat, you really have to pick apart what they cited and make sure you thoroughly understand what it was that they observed or found in your documentation that they're citing. And if you have proof that what they cited or have said is incorrect, that's worth an IDR. If you're very clear on what the citation was and that you've got your documentation. And I would just put a binder together with all of the documentation that I have and report. You can put in a letter to them when you send your plan of correction in that you wish to dispute this citation, even though you've already written your plan for it. And then make sure you've got all the documentation, your argument for your dispute. I recommend writing it out and maybe practicing it with somebody. And for us, we did it by phone a couple of times. And you just, be respectful, don't be argumentative, just lay out your argument for this is what the citation was, this is why we think it's incorrect, and here's our documentation to support it, and that's it. And it's not, if you're respectful, I know a lot of people worry about getting on the wrong side of the surveyors. In Alaska, we're fortunate that I feel like the nursing homes here in Alaska have a pretty strong relationship with our survey team. But if you're respectful and you're direct and to the point, sharing the facts, like somebody said, some things are subjective. Just lay it out and leave it be. And either the tag citation stays or it doesn't. It doesn't really get any worse than that. So
Right. Exactly. Good points. Thank you for that. I appreciate it. So in the chat, Annie says, can we share this with others that you think could benefit? Definitely. So even like when I was doing this one-on-one prior to COVID with our nursing homes, we just had a bunch of new managers and some new people who'd stepped into leadership roles, and they didn't have a clue what a 2567 was or what it meant. And so it was really beneficial. And even the ones that had done it before found it to be beneficial. So definitely, and my understanding from Marcy is the recording is going to be available in about a week with the handouts. Okay. And then Wes has some deficiencies are too subjective. Yes, sometimes you're right. And yeah, office doors not having a big enough sign. Wow, sorry for that. Do you think that more is better in the plan of correction? Sometimes the final is packed with lots of fluff. I am not a huge proponent of more is better in a plan of correction. You want to address the deficiency. And I'll be honest, sometimes reading all of the evidence in the 2567 can be very distracting. And we will go back, we being the leadership team and long-term care here in Glendive, we will go back to what did they say in that first, the deficient practice is evidenced by not doing this. I go back to that. So you're right. And it's hard not to be defensive, but you know, it doesn't help you with the survey agency if you're coming across as defensive, and it's hard. I don't deny that at all. We love our residents and we are so passionate about caring for them. And sometimes when you've been working so hard on something and they cite it for one resident, and yeah, it's frustrating. But I am not a more is better, and kind of the middle of the road gal there. Michelle had a question, and maybe Dana can respond to this in a minute. During an IDR, they've told us they already read the agreement, but for us to present. I guess from listening to Dana, and Dana can jump in if I'm wrong, but I would still present your case.
Oh, yeah.
I would still present, yes, I've read that as well, but this is what we believe, and this is our evidence to say.
Yep. Yeah, I agree. And sometimes you can explain something better in person than you wrote in your letter or whatever. So, and it might refresh their memory of something, or, you know, make them think of a question they didn't think when they read it.
Right. Yes, thank you, Kathy. You used bullet points and had copious notes about why there was a dispute. Yes. Joby has a good point here. More in the plan of correction can tie you to too many expectations to meet and achieve. Very correct. Oh, yep, you have a tag go away only from the documentation you presented and you didn't have to go through. That's correct. You know, when they're gathering their information and they're talking to you and having your conversations as surveyors do, and they're struggling with something, if you can find them documentation, it will go away in the process. The other thing I want to talk, and I know that we have 7 minutes, so I'm going to be really fast, is your QAPI process. If you can tell a surveyor that you're right, we have an issue with XYZ. For example, you're right. We have an issue with notifications, and this is what we are doing to find it. And this is where we are in that process. I still had to write a plan of correction, but that deficiency level dropped. And the plan of correction was written. We were working the process. I just basically reiterated our performance improvement project interventions into the plan of correction. But you're right. Being able to get things out of the record and being able to say, here, this is what we did. And this is where it was, because they're not savvy at our records. We have kind of an unhandy medical record in our long-term care. And so we actually tell them, tell us what you want, we will print it for you. And so they do that a lot. Okay. Other questions or comments? I guess, was this useful for those of you who maybe this was just a refresher, or maybe it was brand new because you're new to your role and you're wanting to learn? Oh, and Marcy just put in that there's an evaluation link. Yes, please.
Yes, we'd love your feedback. You know, MJ and I started talking about this pre-COVID, and then COVID hit and it really got by the wayside. And I thought, well, what about revisiting it? So she was game, and so thank you so much, MJ.
You are welcome. Well, I am so glad to do this. I maybe should have put one of my passions is to walk alongside of others and help them grow and learn. So have thoroughly enjoyed doing this, and would love to have anyone email me with questions. In fact, in the chat right now, I am putting my email address. It's pretty simple. GMC.org. Is there a right number of elements that should be included in each explanation or documents? There really isn't a right number. And I think it goes back to, you don't want to have too much, because then it's going to lead them down a trail you don't want them to go. But you really want to know right away that, yes, this is what we have. So like number one is probably, so if you're looking at the deficiency or tag number, and we're going back to, the number one, address how corrective action will be accomplished. That was, found to have been affected by the deficient practice. That might be as simple as just a Word document stating what was done, or it might be something as simple as there were 2 residents affected and you have to show updates to 2 resident care plans. And so number one is only specific to how many, let's say, residents they say it was affected. It might just be 1, or it might be 5. And then number 2, how are you going to identify others? That's where you're gonna write in your plan of correction that this audit was done and we found, 5 other residents out of 30 that needed to have corrections done, and you have to have those 5 care plans, copies of it to show your corrections. Then you have to have the, if you review the policy and do not make changes, you do not have to have the policy. But if you write a new policy or you make any changes to an existing policy, you have to have a copy of it to show them. This can also be something where, I'm going to go back to the gentleman earlier who talked about, fire doors. And yes, we found 2 other fire doors to be at risk. And, here's the work order, here's the order from the company for the fire door. This is our estimated date of delivery. So that's all there. Okay. Everyone is saying helpful. I'm so glad. So glad. Don't hesitate to reach out and ask a question. I will do my very best to help you within the confines of knowing that I'm in Montana, and some other states may be slightly different. But I would be more than happy to help at any time.
All right, well, thank you, everyone. Again, please complete your evaluation and feedback, and suggestions for future webinars. So again, MJ, thank you so much, and thanks for everybody joining and chatting in their questions and asking questions and providing comments. It's been very helpful. Thank you. And we will again send out that link for the recording when it becomes available.
All right, thank you, everyone.
Be well, everyone. Thank you.